So hello friends, welcome back to my channel Medicine Hub 101. Today I will talk about how to score above on 60 in Fmge exam. The minimum score I will say that on 60. Okay. So if you see the most of the students, those who are taking preparation for Fmge, they just focus basically on some specific subjects. For example, most of the students they focus on medicine, on surgery, on pediatrics and obstetrics and gynecology, for example. They are thinking in this way that if they can complete these subjects, this mean clinical subjects, then they can pass the FMG exam easily. But it's not the right way of thinking. Okay, let me say you that nowadays the question pattern, if you see the question pattern from the last couple of years, from the last 2 years, see the most of the questions are coming from all the subjects. It's not like this that the questions are given from only some particular subjects and some other the paraclinical subjects, or also some other subjects from those the questions are not coming. It's not like this. See, along with the clinical subjects, the questions from the paraclinical subjects are also coming as well. If you see clearly, if you just do the analysis of the question paper from the last 2 years, you'll come to know automatically. Okay, so I'll say that on a student should cover the clinical subject is the first thing. I'm not saying that the clinical subjects they should not focus. They should focus on the clinical subjects. Along with that, they should not avoid the paraclinical subjects in terms of the pharmacology, and especially the pathology, pharmacology, the biochemistry, physiology, also anatomy also. Okay. And another important thing that I had to say that if you avoid subject preventive social medicine, that means the PSM, then maybe you'll be in trouble, because anyhow we have to go through the PSM. Because see, after clearing the FMG, whenever you will get the registrations to practice, because that most of the time the medical boards they tend to send the doctors in the rural areas, in the village area. And in that areas you will see basically the dengue, you will see the basically the some the other the diseases that basically we see. Okay. For that thing we need to have the clear idea regarding preventive social medicine. That's why the number of the questions of the PSMs that will be much more higher in each exam of the FMG, in each exam of the FMGE. So that's the thing. So along with the clinical, we should also focus the paraclinical, and don't forget about the PSM. PSM is doing a important role. PSM is having one of the main contributions for FMG to get passed with the high marks. No doubt about it. So please read the clinical along with the paraclinical, also the PSM. Thank you for hearing me out, and I hope that you will have a great result.